Ailments arising from flights. Passengers suffer from various ailments while undertaking a flight because of their inability to accept and to adjust to certain environmental conditions during the flight and due to the excitement of flying. Especially, the passengers traveling by air for the first time complain chiefly of nausea, vomiting, problem in breathing, etc. arising out of first flight fear and tension. This category of passengers chiefly consists of pregnant women and very young children. Few of the ailments are described, including the symptoms and treatments below. 1. Air sickness. In most of the cases, this ailment generates from the psychological attitude of the passengers and emanates thereafter by being reinforced by tension, heat, food consumption, etc. Symptoms and signs. The passenger might experience nausea and giddiness, might vomit, may sweat profusely, may show facial pallor. Treatment. Open the air louvre and direct the airflow towards the passenger's face. Loosen all tight clothing, especially necktie and collar button. Wipe the passenger's face and forehead with cold, damp towel. 1 tablet of Avamin may be administered. Supply a number of air sickness bags and a wad of tissues for his or her use. Advise the passenger to consume 1 tablet of Avamin 1 hour before the departure of the flight he or she undertakes next, as the effect of Avamin tablets begin only after a certain period. 2. Earache. This is one of the common ailments amongst air travelers and occurs due to change of cabin pressure during climbing and more often during descent. Treatment. Passenger is to be served with something to chew like toffees. Advise him or her to massage behind and below the earlobe. Administer any ear drop. Administer an aspirin tablet. 3. Effective decompression on passengers. Decompression at a high altitude is considered to be a major emergency condition. Decompression occurs due to a sudden and rapid loss of pressurization inside the cabin. This creates a deficiency of requisite oxygen for the human body. To counter this terrible situation, oxygen masks drop down for every passenger. Due to this decompression or a sudden decrease in surrounding pressure inside the passenger cabin, the air in the hollow organs of the body tends to bulge the organs and bubble out in body fluids, adversely affecting the body. Symptoms and signs. The patient would complain of experiencing severe pain in the abdomen, ears and the body joints. Swelling of the abdominal region could be observed. Passengers with less power of resistance might even become unconscious. Treatments. Keep the patient warm by tucking blankets around him or her. Administer oxygen immediately. Impart treatment for shock, senselessness, and hypoxia, mentioned later in the chapter, depending on the gravity of the case. 4. Hypoxia. This ailment initiates when the brain and the body tissues receive an abated supply of oxygen than the requisite quantity for the proper functioning of the organs. Symptoms and signs. The patient would show a lack of interest in surrounding affairs. He or she would have a lack of energy and vigor. The patient would display erratic behavior on negligible happening at a certain time. The patient would complain of giddiness and blurred vision. The breathing of the patient would be rapid and would become irregular later. The lips and nails of the patient would turn pale or bluish. His or her pulse would be rapid but weak. Unconsciousness at a later stage cannot be ruled out. Treatments. Impart general treatment for unconsciousness. Administer oxygen. Recline the seat back. Arrange for the patient to be attended by a doctor at the earliest. 5. Wounds. Passengers could manifest wounds, which might have occurred lately, or be old ones that might have aggravated on board. These can be of various types, viz. an abrasion, an incision, a skin puncture, a laceration, a contusion, etc. All these types of wounds bleed. Treatments. If possible, raise the wounded part to decrease the blood flow to the part. Expose the wound by removing any clothing covering it. Expunge the easily removable foreign objects. Dress and tie a bandage on the wound. Immobilize the part with the help of a sling, if necessary. Administer an aspirin tablet. Precautions. Do not probe any object embedded deeply in order to extract it. If any object is deeply embedded in the wound and also protruding out from the wound, the bandage should be tied over 2 improvised paddings placed one on each side of the protruding object high enough to disallow the bandage to touch the object. 6. Burns and scalds. Though it is quite unlikely and unwanted for the passengers to suffer a burn or scald on board, the same may still occur. However, cabin crew themselves are much more susceptible to be affected with these ailments. These are very painful and are extremely vulnerable to infection. Symptoms and signs. The person is in great pain. Blisters appear on the skin of the affected zone. Symptoms of shock could be noticed due to loss of blood plasma. Treatments. Cabin crew attending to such cases must wash his or her own hands with soap and rinse with Dettol or Savlon thereafter, before touching the affected zone. Rinse the part with flowing ice water or chilled water. The affected part should be covered with a clean and sterilized dressing. The part should be immobilized. The person might have to be treated for shock. 7. Fracture and sprain. Sprains could be treated with basic first aid to subside the pain by administering a tablet containing aspirin, but the fractures are to be dealt with much more care, seriousness, and professionalism. Symptoms and signs. Acute pain at and around the affected part. The part shows swelling, tenderness and/or deformity. The part can hardly be moved. The temperature of the affected zone would be higher than that of the other parts of the body. The texture and continuity of the bone could be felt to be coarse. Treatments. Support the part with the help of a splint and immobilize the same by tying a bandage including the splint. In case the bone is protruding out of the skin, bandage it. The bandage should not touch the bone. Administer a pain-killing tablet. General treatment for shock should be rendered. Arrangement for the patient to be attended at the earliest by a medical practitioner is to be made. Transportation of the patient to a hospital might become necessary.